This is a review of different mental illnesses. Mental illness is basically defined as a clinically significant behavioral problem. It's often associated with distress, and it can cause a disability that impairs your functioning. Not always, though. There are a lot of people that are experiencing mental illness that you would have no idea. Mental illness doesn't have anything to do with intelligence. Can be anybody. It is difficult to diagnose and treat. And mental illness is treated, but it's not cured. Some general signs of mental illness. Usually you can observe it. You will notice it. You can see in some cases, depending upon the illness, confusion, disorientation, talking to themselves, could be poor hygiene, inappropriate attire, but again, not always. It could be the person just walking down the street that looks like the happiest person in the world and put together, and you don't know what's really going on in their head. These are what pretty much the signs that you would think that you would see. The withdrawn, very sad, someone having a panic attack, psychosomatic complaints. Now, what's that? That is when you have a, a backache and you keep complaining. A patient complains of a constant backache, yet nothing's been found. Everything is checked out. Everything's fine. And a lot of times it's, not a lot of times, but it could be an actual mental issue. And sometimes people with depression, they ache, they hurt, they're tired, and it's all due to actually to their mental illness. First, we're going to just jump right into schizophrenia. That one, the cause is unknown, but it's believed to be a combination of genetic, physical, psychological, and environmental factors that makes a person more likely to develop this condition. A stressful or emotional life event can trigger a psychotic episode, and often substance abuse can be a trigger. It affects their ability to think, feel, and behave. It impacts 1 out of 100 people. It doesn't show up. Typically, it does not show up in youth. It usually shows up in late teens, early adulthood. Schizophrenia is known to have positive symptoms and negative symptoms. Basically, positive symptoms are things that they begin to do, such as have hallucinations or delusional thinking. This is the hallmark of schizophrenia, is that they start hearing things or seeing things. That's a big thing for schizophrenia, is that they are hearing and or seeing things. Negative symptoms is things that they no longer do, that you take away. That could be the apathy or the withdrawal. So when people talk about positive symptoms versus negative symptoms, just remember, positive means it's something that they're having or they're doing that's in addition to something that's maybe new, and negative would be something that they're no longer doing. It's taking away. So a lot of times they are agitated by voices and delusions. Um, they can have command hallucinations. Those are the people that, you see like the women that have killed their child. And it's like, well, I heard the voice in my head said that, they were the devil and I must kill them. That's when it becomes dangerous. That's when it's scary, because they're actually following the voices in their head. People that are affected with schizophrenia, if you yell at them or speak at them very fast, it's just going to overwhelm them and confuse them, and it's not going to be good. You need to give very clear directions. You need to speak in a very kind, calm voice that reassures them. This will tend to calm them. Think about like an animal, if any of y'all are animal people. I've seen a feral cat that was just going crazy and just, Actually, one time a feral cat got into my house by accident. The door was cracked open, and my husband was trying to catch it, and he was, of course, kind of like yelling and, oh my gosh, get this cat out of here. And the cat was freaking out. And I'm like, nope, 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 let's be calm. So I was like, it's okay. It's all right, kitty. It's okay. This is a feral cat that didn't want to have anything to do with us, but just me speaking very calm and soft, it calmed it down. And then I was able to guide it out the door. People are the same way. If you speak to them very calm and soft, they will calm down as well. They will mirror you. Medications that's used for schizophrenia typically are antipsychotics, such as prochlorperazine, olanzapine, risperidone. I see that one a lot. Haloperidol. We see haloperidol is a real common one. Chlorpromazine, quetiapine. The goal of this medication is to help organize their thoughts and eliminate the delusions and hallucinations. Again, the medication is to help organize their thoughts, eliminate delusions and hallucinations. And sometimes these medications, one medication may work better than another, and often with mental illnesses, you have to tweak the medications, and people get frustrated when they do have a mental illness because they're like, I took that medication, it didn't help. Well, maybe that wasn't the right one. So it is a struggle to try to find the correct medication because one may work better than the other, another may not work at all. So you do have to kind of tweak the medications. Medications like antipsychotics do have some side effects that can be pretty severe. Extrapyramidal side effects, those are things you need to look for when someone is on an antipsychotic. That's when they could start developing tremors or shuffling gait or dysphagia and drooling. One of the worst is if they develop tardive dyskinesia. That's a protrusion of the tongue. They have a chewing motion, involuntary movements. These are things that with typically long-term use of antipsychotics can cause. The newer antipsychotics, it's not as common, but the older ones, this is something that you would definitely need to be concerned about and watch for with your patient. There is, they don't know what the reason for schizophrenia is. There's no known reason, no known cause. It's not curable, but it is treatable. All right, major depression. So major depression does affect 5% of the population. Honestly, I think it's more than that. I think 5% of the ones that are actually being treated. I think a lot of people are untreated. Major depression is a sad mood that lasts more than 2 weeks. I mean, everybody gets sad. Everybody has sad times. There's situational depression. You have something really bad happen. You've lost your job or you had a death of a family member. Yeah, you're going to be sad. That's normal. Where it becomes a problem is when you can't get past it. It lasts more than 2 weeks and you cannot get past that mood. A lot of times major depression, people, I mean, they just don't even want to get out of bed. They just want to stay in bed. They want to sleep all the time. Their hygiene is poor because it's just too much energy to take a shower. They don't eat. That is severe depression. With depression, the risk of suicide is high. Some medications that are used for major depression are typically selective serotonin reuptake inhibitors, SSRIs. These basically block the reuptake of serotonin, which will increase the serotonin levels. Some examples are citalopram, fluoxetine, sertraline. I think fluoxetine is Prozac, sertraline is Zoloft. When it says blocks the reuptake of serotonin, that actually just means that the synapses there and it's shooting over these neurotransmitters. The receptors on the other side that catch it, they catch those, the neurotransmitter. There's only so many receptors and they catch a certain amount and the rest of the serotonin is just in that that synaptic cleft there, and they're just sitting there. And so your body tends to absorb it. So it absorbs it back in. But the reuptake means that it doesn't allow your body to absorb it. So that means that there's more serotonin sitting in that little spot, and so it's getting constantly fed into those receptors. So that's why it increases the serotonin levels. This could be anything. You have, dopamine, reuptake of dopamine. It's the same thing. It just basically keeps your body from absorbing it so that it increases that amount, so that it increases your levels. You also have serotonin, norepinephrine reuptake inhibitors. These are your SNRIs. Increases both serotonin and norepinephrine, like duloxetine is one of them. Atypical antidepressants like bupropion, that's Wellbutrin. Tricyclic antidepressants that blocks the reuptake of norepinephrine and serotonin, again at the presynaptic junction. Medications, depression, antidepressant medications, actually any basically mental health medication, it doesn't kick in right away. You have to, it takes a while. It takes a good 2 to 3 weeks before you'll feel the full effect. Again, this is why a lot of people are not treated that should be, because they think that it's a magic pill. They're going to take one pill and, oh, I took a pill and I didn't feel any different. Well, that's not how it works. It takes a while for it to completely kick in. And a lot of people aren't aware of that. And again, and it may be they may have to tweak the meds. They may be given an SSRI when really they need an SNRI, or maybe they need a tricyclic. So it really is frustrating to the person suffering from mental illness, because they feel like they're just not getting any better, and they get very frustrated, and often they quit seeking treatment. All right, next one is bipolar. Bipolar is basically, it is, people have mood swings from depression to mania. And there's different types of bipolar, like bipolar 1, bipolar 2, rapid cycling. Bipolar 1 is the classic, where people are like severely depressed. They're the ones that can not even get out of bed. And then when they go to flip to the mania side, they don't sleep for days, and they have grandiose ideas. I'm going to go and get a doctorate degree, and I'm going to do this, and I'm going to become an astrophysicist, and then I'm going to become an astronaut. They just go from one extreme to the other. Bipolar 2, it's a little bit, take it down a notch. Also bipolar 1, sometimes the cycles last longer. They may be depressed for a full month and then have mania for a full month, or sometimes even up to 6 months. They could be depressed for 6 months and then have mania for 6 months. Bipolar 2 is a little bit less. They're depressed, but often they're still able to function. The mania means they're just happy. They're excited. They're going to talk fast. They don't need to sleep as much, but they can still function in society. And often they will go from depression to mania a little bit faster. Sometimes the cycles may only last a couple of weeks. You also have rapid cycling, which could be, they could have flip from one mood to another within the same day. And sometimes within mid-conversation, they can be, really elated and happy and manic, and then all of a sudden flip. So it's really sad. They definitely need a mood stabilizer to help keep them on an even keel. Often it's not even the depression. They don't even get depressed. They're just irritated. They're irritable. So they can be really happy and then just become very irritable, very touchy. You have to be careful how you speak to them. Medications, again, are the mood stabilizers. Lithium is a big one that's used. Now remember, lithium's a salt, and lithium has a very narrow therapeutic window. So it needs to be tested often, because if you don't have enough, they're not going to have any kind of effect. But it's very easy for lithium toxicity. And that can put somebody in the hospital pretty quick because, again, things that can change it even because it is a salt. If someone's salt intake changes, suddenly they decide not to eat as much salt, or now they've just ate a bag of chips. Just something like that could throw off the dose that's required for lithium. A common question that I see on exams, NCLEX exam, HESI exams, it seems like they always want you to know the therapeutic serum levels of lithium. So you just need to memorize this because you're going to see it. You're going to see it somewhere. The therapeutic serum level of lithium is 0.6 to 1.2. So again, remember, there's a very narrow therapeutic window. Toxicity is common. When they're taking lithium, it's very important they need to drink at least 6 to 8 glasses of water a day. You should also not take lithium during pregnancy because it is toxic to the fetus. Lithium is not the only drug, but it is, like I said, one of the most common ones. You also have risperidone. You also have fluoxetine can help with this, but you do need a mood stabilizer. If you're going to give an antidepressant, you're only treating half the problem. There's different types of mania. You have hypomania, acute mania, and delirious mania. You can see here on the diagram, hypomania is very mildest form, where basically they just have decreased sleep, they're irritable, they've got some euphoria. Acute mania is when they have, again, lack of sleep, they've got a lack of judgment, some cases onset of psychosis. And then you have the delirious mania, which is when you will most likely require hospitalization. There's been a lot of studies showing that like hypomania, that's part of bipolar 2. There's been studies and there's been books written that a lot of the most productive people in society typically have bipolar 2. And the reason for that is because they don't require very much sleep and they're able to control their depression, so they're able to function still, but also when they're in the manic phase, they only need like 3 hours of sleep. So they're able to get a lot more done. And not saying that it's good to have bipolar 2, but some people are able to use it to their advantage and are able to function. I can't get my slide to change. All right, so again, a little bit more about mania. Mood can swing from entertaining to hostile. Their talkativeness can be irritating. They're in a talkative mood. They're going to stand there and talk to you for 3-4 hours at a time and not let you get a word in, and you just have to listen to them. When they're depressed, they cry, they feel hopeless, they become suicidal. They can also pace. They can be very demanding, destructive, and they're often non-compliant, especially with medications. Again, here it says, can be professional, well-educated. We're going to move into anxiety disorders. Now, one of the things I wanted to say about depression and bipolar, when they start taking medication, you know how with those antidepressants in the commercials, they say risk of suicide can be increased. And it always makes you think, well, why would I want to take that if it's going to increase my risk of suicide? Well, do you ever think why? Well, when someone's depressed, they have no energy. They don't even feel like getting up and taking a shower. So committing suicide is just going to take too much energy. Yeah, they want to commit suicide, but they just got to take a nap instead. When they start taking an antidepressant, and again, it takes a while for it to fully kick in. So when it starts kicking in slowly, now they're going to perk up and they're going to suddenly start getting a little bit of energy. They're still not going to be feeling good, but they're going to have enough energy that now they can say, great, I got some energy, now I'm going to kill myself. So that's why when they first start taking antidepressant, you need to keep an eye on them, because when they first start getting a little bit of energy, enough to get out of bed, that's when they're at risk of killing themselves. Once the antidepressant takes full effect, then it's going to lessen that risk. You have different anxiety disorders, and there are a lot of different anxiety disorders. People say, oh, I'm feeling anxious or I have anxiety. There's many different types of anxiety. Panic disorder is typically when people have panic attacks, when they have anxiety that they can't control it. It says women twice as high as men, 1 to 2% of the population. I don't believe that either. These were facts that I had pulled, but I don't believe it because I can't tell you how many people I know that have panic attacks or believe they have heart issues, because how it will show up, just out of the blue, they'll suddenly start having heart palpitations, they'll have chest pain, shortness of breath. People show up to the emergency room all the time thinking they're having a heart attack when in reality they're having a panic attack. People also get really worried about having another panic attack, and so that only causes more anxiety. Medications that typically help with panic attacks are SSRIs, such as your Prozac, Zoloft, Paxil. Now, you can also give them benzos. Benzodiazepines will help as well. Obsessive compulsive disorder is also an anxiety disorder. It is when people just have thoughts that cause them anxiety. A lot of times they're illogical, but they can't control it. They always think the worst. They worry about things. They worry about driving over a bridge because what if the bridge collapses? And they obsess over it. The compulsion is when they have repetitive behaviors. Often it's an attempt to reduce the anxiety. So people that do have, like, where they want everything in a certain place and they want everything put away at a certain, and it can't even be, a centimeter out of place. Those are all behaviors to attempt to control their anxiety. Post-traumatic stress is also another anxiety. It's typically caused from an extremely stressful event. We often associate it with soldiers that have come back from war, but it can be any kind of post-traumatic or any kind of stressful event. It could be a death of a loved one. It could be being in a car accident. Yeah, if you've ever been in a bad car accident, and then you get back in the car and you're really nervous to drive, that's a post-traumatic stress disorder. And fortunately, those are typically short-lived and you can get past them. There's some that people cannot get past. It does affect their life and impacts their ability to hold down a job. They could have a lot of painful memories, nightmares, depression, could be feelings of guilt, problems sleeping. If they run into another similar event, it's going to even worsen. Substance abuse. I don't know how to go backwards. I jump forward and I can't go backwards. Shoot. Substance abuse is often a coping mechanism. Typically, people with post-traumatic stress, they'll be given some anti-anxiety medicine, some benzodiazepams, any of your PAMs, your lorazepam, your Ativans, things like that. So with mental health, in order to be a caregiver for someone with mental health, you need to learn therapeutic communication. Therapeutic communication, you need to show empathy, not sympathy, but empathy. You need to show warmth, and you need to be genuine. The minute they feel like you're fake, you're done. They're not going to have anything to do with you. To promote communication with someone, you just need to listen. You need to listen, but you need to pay attention to both their verbal and their nonverbal. You need to observe their body language. You need to make sure you avoid distractions because that will shut them down. You need to clarify what they're saying to you. You need to restate it, repeat, clarify, and question. They say, I have a lot of difficulty sleeping. So, okay, what I heard you say is you're having problems sleeping. Is that correct? And then you can question them. Well, does this happen every night? You want to avoid asking yes, no questions, which are closed-ended questions. You want to ask questions that will prompt them to give you more detailed answers. Dealing with silence. Sometimes people are going to be silent. They're not going to talk. Sometimes it's best just to let them be silent for a little bit and just sit with them until they become comfortable with you. Maintain your personal space. Don't get up in somebody's bubble. There's your open-ended questions. And watch your nonverbal cues. Watch their face. Watch their body language. They start crossing their arms. They're shutting down. So you need to take a step back and do a little bit of a retreat. Nonverbal communication, that could be their body posture, their facial expression, their eye contact, their gestures. You need to watch that for that. Suicide prevention. That's lovely, isn't it? 8 out of 10 people that have committed suicide have given prior warnings. A lot of them, they don't care about death. They're very ambivalent. I don't care if I die. Risk does not increase with discussion. People feel like, oh, if I keep talking to them about suicide, then they're going to do it. No, the more you talk, the more risk is going to decrease. If they've had a prior attempt, their risk increases. Look at this, 61% have major depression, 48% have a personality disorder, 40% of alcohol use, 10% anxiety, and only 6% schizophrenia. Isn't that interesting? Major depression, or, look at that, 40% with alcohol. Alcohol is a depressant, so it kind of depression and alcoholism goes hand in hand. An evaluation tool. You have it's called a SAD person scale. You look at their sex, their age, whether depressed, any previous attempts, alcohol usage, their rational thinking, any social support. The lack of social support is a huge risk factor. Do they have a plan? That's what we say. Someone that's you feel like they're suicidal. Are you having suicidal thoughts? They say yes. Then you say, do you have a plan? That's an important question, because if they say yes, I have a plan, you're probably going to need to have them Baker acted. No spouse. That's a risk factor. People feel alone. They don't feel like they're supported. Or if they're ill, especially a terminal illness. That's a huge risk factor, especially with older men. Suddenly they have terminal cancer. It's a way for them to have control of the situation. No one likes to lose control, and when you have an illness that is taking control of you, the way they want to take control back is to go ahead and end it themselves. Often it is an impulsive act. It could be just a sudden impulse that they have, and they immediately act on it. That's scary because that doesn't give us very much warning. They're just suffering so much they just can't take it anymore. They hurt so bad they just want to end it. So they feel like they don't have anyone to communicate to, or if they've lost a loved one, they want to be with that loved one. Often they feel suicide is the solution to a problem. We need to find out, what is the problem? Why? Why do you want to do this? It's usually an act to an intolerable feeling. They can no longer cope. That's what we need to do, is help them find coping mechanisms. Let's find you a coping mechanism. Tunnel vision, they can't see any other alternatives. This is the only thing they can see. The only option is to commit suicide. Some signs also that you need to watch for: people start giving away belongings, precious belongings, things that they've cherished. Now they're giving them away. That's a sign you need to watch them, because they've got a plan. Interventions. We want to make sure you have a safe environment. I know if they're Baker acted, they can be put on suicide watch. They will have any means that they would to possibly commit suicide would be taken away from them, taken out of their reach, or they would not be able to have any way to commit suicide. They don't like to be in a situation where they have a lot of people trying to talk to them because they feel like they're being ganged up on. So they really just need to have kind of one-on-one communication. Again, talking about the plan, ask them about their plan. If they say, oh yeah, I have a plan, I plan on taking a whole bottle of sleeping pills, then your next question should be, do you have access to sleeping pills? And if they say no, well, okay. But if they say, oh yeah, I have some in my medicine cabinet at home, that's, that's a pretty serious issue. You need to probably have them Baker acted. Emphasize positive. You need to try to find the positives in their life. And always refer for treatment. We are nurses. We're not trained in healthcare. We can recognize it. We can do therapeutic communication, but people they're going to need a professional, licensed professional to help them. Don't ever lie. The minute you lie, the minute they feel like you're lying to them or you're being fake, they will not have anything to do with you. They will not talk to you. They will not give you the time of day. Don't lie. Even if the truth hurts, it's the truth.